Hello friends, how are you doing? Welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you, but help you to move on to the bright side of the health. So you must have watched me in a lot of videos talking about Bell's palsies and kinesis, aphasia, etc. It's been a while. I have not posted any video where I give more details about me and my organization so that I can answer some of the common doubts or questions that can come into your mind. So this video is going to be about me. Who am I? What I do? Where do I practice? And some other common questions that people frequently ask. Let's get started. What's your name? Well, my name is Physio Meghna Dave. I am a neuro rehabilitation physiotherapist. I have done my master's in neuro rehabilitation and I have been into practice from almost 18 years now in space of physiotherapy, especially in neuro rehabilitation. What's my qualification? I've done my BPT and MPT in neurosciences. My specialization during my MPT was in adult neuro rehabilitation, where my core work was on stroke rehabilitation. What's your designation at the place where you work? Well, I run my own venture, which is called as HealthQ Rehab. I'm the founder and CEO, and I'm also working as a principal physiotherapist here. My organization is located in Bangalore, specifically in Sarjapura. The location details are mentioned in the description box below. Is there any other place where you are associated with? Is there any other hospital where you visit? No. I only practice at my own center. I'm not associated with any other hospital organization. So if you want to consult or take help, then you need to directly reach out to the contact details shared. What do I do? Well, as I told you, that my key focus of work is in facial rehabilitation. I deal with people suffering from various musculoskeletal and neuromuscular disorders that's related to head, neck, and face, where we cover different conditions like, first of all, and the most important one, Bell's palsy, synkinesis, stroke-based facial paralysis, aphasia, hemifacial spasms, facial asymmetry, TM joint disorder, cervicogenic headaches, cervical disorders, and facial asymmetry due to postural issues. Why I chose to work in facial rehabilitation? Well, this is an accidental story. When I started my career, I started as a neuro rehab physiotherapist. Since my thesis was in stroke rehabilitation, I was very much keen for working with stroke patients. But eventually, once when I was creating my YouTube content, I got a case which was of Bell's palsy. Unlike all physio, I also had a very limited knowledge about Bell's palsy and synkinesis. Our textbook itself have very limited section which gives elaborate details about Bell's palsy. But when I started working with one patient and then gradually I came across other patient, then I realized the intricacies of it. There is a lot of depth of work that can be done in facial rehabilitation space. And that created a deep interest. And that's where I started more reading about this condition, working with patient, applying the knowledge that I gained with my research on the patients. And I saw that what are the different methods that have been proven by evidences when applied in right manner with the right protocol gives amazing result. That finding created more key interest in the entire space of facial rehabilitation. And I realized that this is the space which is my calling and I want to dedicate my entire work of rehabilitation into the space. What am I working towards? Well, I'm very deeply working towards the Smile Strong program, which is a flagship program that we have created here at HealthQ Rehab. That is to help patients suffering from synkinesis to reverse their challenges with synkinesis. What's unique that we have figured out is synkinesis is majority of time the backfiring of neuroplasticity. And it's a reverse engineering work that we need to do in synkinesis to negate the effect of overcontraction, of not using the facial muscles in the right manner, or you can say overusing the facial muscles. And how do we bring that back again to normal and how we can help people suffering from synkinesis to regain their confidence, regain their life, and regain their smile. That's our motto at HealthQ Rehab at this moment. What's your vision with HealthQ Rehab? Well, my vision with HealthQ Rehab is very simple. I've mentioned this many times. This is just the beginning. We have seen that according to WHO, 1.3 billion people globally will need rehabilitation services, and we eventually want to become that organization that caters to the entire globe and help them in overcoming this very pressing need of rehabilitation services among people. It's a long journey, but let's see how we go forward. What we do differently at HealthQ Rehab? Well, this is a very interesting question. Many patients or people ask us, like, what you do different, like, how different is your program from other traditional Bell's palsy rehabilitation? Well, we go very, very, very deep into Bell's palsy rehab at every stage of Bell's palsy, starting from acute phase to subacute phase to synkinesis, and even in synkinesis phase as well. We break down the synkinesis in as detailed as possible. Our focus is on quality over quantity. That's why we work with very limited clients, but with whom we work, we ensure that we give a very personal attention, very close attention to each and every challenge that they are facing. And the second important thing that we do is we use a very integrated approach when it comes to rehabilitation, because we believe it's not just the exercises that's going to help. Psychosomatics play a very critical role when it comes to facial paralysis or synkinesis recovery. Nutrition play a very critical role. The overall consistency into the practice play a very critical role, and we try to ensure that we become that hand holders for our clients in achieving that results by staying consistent, by being very strategic on what exercises we are giving at what time, so that we can help them achieve the best possible results of synkinesis reversal, unlike any other organization in this world. So, how to reach out to us? Well, it's very simple. We have mentioned contact details, our website links in the description. All you need to do is just go to the website. There will be a booking appointment request form. Just fill that, or else you can just directly WhatsApp us over the phone number provided and just request for an appointment. The process is very simple. Once you request an appointment, we schedule an appointment based on the availability. And after the appointment, the first consult session, this is basically a deep evaluation, trying to understand your history, trying to understand what are the key concerns. Based on that, we frame out what is going to be the recovery plan for you and what is expected, what is possible to be achieved, what is not possible to be achieved. So we do a very clear expectation setting. And then we recommend the right type of program to you. And then if you are okay starting the program, then yes, we can definitely start the program and then we work on it. Our program is not a very traditional therapeutic program itself. As I told you, it's more of a combination of wellness practices, self-care practices, personal care practices, at the same time, the therapeutic part as well, combining so that we can give the best outcome of recovery. From 2020 till today, we have approximately helped 1,000 patients, individual patients suffering from Bell's palsy, synkinesis, facial paralysis, or facial face-related conditions through our programs. So my key message that I would like to give to all the patients who are suffering, to all the people who are suffering from Bell's palsy or synkinesis, number one, be patient. This is very important. It is not that if you don't recover in first 3 months or 6 months, you will never recover. Recovery is always possible. And the key principle that we use while working with any of our clients is to tap into that untapped potential that's present inside you. How do we take that out, apply it into the daily practice so that we can achieve the maximum possible potential? Second, most of the Bell's palsy recover if therapy is done in the right way at right time. So choose your therapist very wisely. That's my second thing that I would like to tell. Number three, I see that people find it very difficult to accept that this has happened to them. And majority of time, all the frustrations that they go through is because of that. First thing is accepted that this has happened and it's okay. It's not the end of the world. Still, there can be work that can be done. If you have that positive mindset and if you work with that mindset, the journey becomes far, far, far more smooth rather than having all the negative emotions inside you. Bell's palsy, synkinesis is a lot about your emotions than you think. If your mindset, your emotions is right, things will work in your favor. So this is my ending message. I hope you got a fair idea about us. And if you have any other queries, feel free to reach out to us. Thank you.